Hi, I'm Kat Joseph with the Paisano. I met with Dr. Pasalacqua, Dr. Klein, and Dr. Khan to discuss the new health communication concentration.
The department has been wanting to do a concentration, but the three of us came together and we said, what would that concentration look like? And so we said, of course we have to have something to introduce students. What is health communication? And get them thinking beyond either doctor-patient interaction or health campaigns, those pamphlets that they get, or advertising. And so to really get them to expand their understanding of what health communication refers to.
This is like a food after it goes through the fire. It can be whole again.
Interpersonal, which covers all kinds of communication that Dr. Pasalacqua can talk about and has mentioned so far, but doctor-patient interaction, but also family communication and social support.
Your emotions get all screwed up. But eventually, they're going to settle down. Just be calm and wait.
We did it because health has become such a focus in the United States and globally, I think, right? And absolutely. Health communication is in part a theoretical perspective, understanding theory, but it's also a very applied perspective, and so there are tons of jobs.
Absolutely, there's a degree of marketability there with the health communication concentration, especially being that healthcare is the industry that consistently year after year experiences job growth even during times of economic downturn.
Health is one of the pillars of University of Texas at San Antonio in terms of its priorities. And so we feel that the goal of the department very well aligns with the goal of the university.
Dr. Pasalacqua believes the concentration will help students develop health literacy and improve their interpersonal communication.
You are your number one health advocate, and how do you do that? Well, you learn about the more effective ways to speak with your healthcare provider. You learn how to navigate the system. You understand how things work and why things work the way that they do. And even something like grief communication. We talk about grief communication in my interpersonal health communication class.
When I was 4, I realized what died meant. It meant mommy wasn't coming back.
So learning how to do things like talk to the bereaved. Most of us have no idea what to say to someone who's lost a loved one. We go over that in the class. We talk about discussing illness with your children.
And they walked in and they said, well, we just want to know whether or not we should tell our two children that Dad has cancer.
And those are things, it's very pragmatic knowledge that I think that we can all use in our daily lives.
I teach health campaigns, and all of the stuff that we talk about, they can use in other kinds of areas. So like if they end up going into some other kind of marketing or they, some other kind of business, it doesn't necessarily just have to be about health, but it is generally pretty interesting because they all have a personal connection in some way, shape, or form.
Health communication is ubiquitous, so it's all around us. Students don't realize that something like fat talk, oh my God, I'm so fat. No, if you're fat, I'm humongous. That's actually an area of study in health communication, looking at how those types of conversations impact the way that we think about our bodies and our weight, and then of course it impacts our behaviors.
Taking those pills. They don't even really believe that those pills are bad for them.
Watching all our favorite TV shows or the movies or reading magazines or listening to music, right? So there are messages in all of those things that people don't really pay attention to.
And I think that once students realize what health communication encompasses, they suddenly become very interested in it.
I think this is very special to the discipline of communication, but I think particularly to our department, because like all three of us do health communication, but we do different things here. So Dr. Pasalacqua focuses a lot on interpersonal communication. Dr. Klein does a lot of popular media. I do public health. It is very much, about communication at the grassroots level, how communities mobilize, how do they organize certain, programs, how do they do HIV prevention work, how does leadership work? Because global health, for example, that I do is not simply about the developing countries, it is very much about us as well, because the way the world is changing. The world is one small place, and diseases know no boundaries.
The health communication field has a wide range of opportunities, making this concentration valuable for students.
If you Google health communication jobs, there are an incredible number of jobs, to the point where I couldn't even just write it all down. There was no way to kind of capture the numbers.
So you could have everything from students going into patient advocacy, healthcare administration, involved in things like the Center for Disease Control, everything from that level, the National Institutes of Health, to working at our healthcare systems.
So you have so many areas that students can actually go. Digital media, lots of campaigns are happening in the realm of social media.
Having someone who specializes in health communication at a newspaper or a magazine, it has become increasingly important because it's hard.
The foundation is at the undergraduate level, because if you've done health communication concentration and you want to go further, you could go and do masters and PhD, of course, but it has to start from somewhere. I can understand the logical connections that you made, but that's not correct. Okay?
Something unique about this concentration is that we bring members of the community into our classes. We've had a number of guest speakers, from an ICU nurse to a young woman who has had spina bifida and is a very outspoken advocate for interability communication. We had the executive director from the Children's Bereavement Center of South Texas who came in and talked to us about the work that they do there.
One was from Texas Health Science Center, the assistant director of Global Health Center from there, and he came and gave a talk on water and sanitation. And these are the opportunities that we want to provide to our students, who are not simply learning from us in our own personal capacities, but also from others around us who are. And San Antonio is the best place for it, because we have the Texas Health Science Center, we have a lot of community health interventions happening in the town, and we have other resources as well.
The professors train students to apply class education to real-world experiences.
One of the things we really are looking to do with this concentration is have our students be involved locally in health organizations. And a number of the courses that we have in the concentration are designed to get the students out and involved in the community. And my students have gone to everything from dance-a-thons to benefit multiple sclerosis, to tours of the Children's Bereavement Center, to motorcycle rides for PTSD. And another thing with the health communication practicum is that the students go and spend some time with local healthcare organizations and reflect on how the operations at those organizations reflect the health communication concepts that they've learned about. And so we are both very theoretical and applied.
Absolutely.
Both with this concentration, which I think is very important. It's the way that health communication should be done.
In my courses that I teach, they always have to have a health issue for which they should be finding some solution or providing some recommendation. They draw on those concepts and theories and and the background that they learn from, and they do real original research of their own, and they apply that, and then they come up with their own intervention strategy, either at the community level or in terms of policy or even campaign design. And this actually prepares them for any career that they might have, either at the community level or at the international level.
Well, basically the concentration is 5 classes. There's an intro to health communication for all the students. They take that one. It's a prerequisite for the next 4 classes. So there's interpersonal health communication, there's health communication campaigns, and there's global health communication. Those are the three, and they can take them at the same time, those three classes.
And then the kind of signature experience, the senior class, is the health communication practicum. And that's the course I was mentioning before, where we have the students engaged in community health promotion activities and spending some time at organizations in the community so that they can see health communication at work.
The first course that they have to choose in order to be in health comm concentration would be the intro to health communication.
Students can sign up for the new health communication concentration with their advisors and can sign up for classes on ASAP. You can see how you like it by taking the Intro to Health Communication class before signing up for the concentration.
And if someone has not even thought about engaging...
Thanks for watching. Click our logo to subscribe, or click one of the videos for more from the Paisano. Leave a comment letting us know your thoughts and what you'd like to see us cover next.